Good morning, Greenville. This is Dr. Matthew Warner here at Willoughby Dental, and I wanted to spend a few minutes here to talk with y'all about tooth decay and the reasons for it. The number one reason for tooth decay is poor oral hygiene. So that's why we, as dentists, dental hygienists, dental professionals, we recommend to get your teeth cleaned twice a year and that you brush your teeth twice a day for at least 2 minutes. That's the kicker. Make sure you're getting that full 2 minutes in. Flossing twice a day, and using any kind of mouth rinse such as Listerine, Crest Pro Health, things like that. Another great mouth rinse to actually help prevent tooth decay is Listerine Total Care or Act mouth rinse. You can get a little extra fluoride, which is going to help remineralize those teeth in any spots that may be starting to demineralize. So basically what happens is if we don't brush our teeth and floss and rinse, plaque adheres to the teeth. Plaque is basically bacteria, and then what happens is the bacteria start to slowly eat away and cause decay on those teeth. Now, tooth decay is actually an infection. It's actually called a disease, and it's probably one of the most prevalent diseases out there besides the common cold. And it's stated that 72% of people have a cavity before the age of 17. And so that number is really high. So let's really kick our oral hygiene up a notch here, guys. The next reason for tooth decay can be the shape and the anatomy of the teeth, especially those back teeth, those molars and those premolars. Those teeth have what we call pits and fissures, or little grooves down in those teeth. And certain people have more prominent grooves and are more prone to decay in those spots. But what happens is food, sticky substances, sugary substances can get down into those spots, and those toothbrush bristles can't always get down into the base of those grooves. And so what happens is it builds up, and that bacteria comes in and it starts to eat on it and stick to it, and it causes the decay on those teeth. So if that happens, what we do is just put a little filling there, get it patched up. Should be in good shape. Ways to prevent it would be spending that full 2 minutes, especially in those back teeth, brushing. Another way to prevent it, and a really good way to prevent it, is if you have those nice prominent pits, you want to put some sealant in it, which is a resin material that flows right down into those grooves, so that you don't build any plaque in those areas causing cavities. Another reason for tooth decay would be poor diet. So basically, all that sugary stuff, let's stay away from it. That's what that bacteria likes to eat on, likes to feed on it, and it just helps bring more plaque about and more problems. So stay away from the sugary stuff, obviously, and then certainly acidic drinks and juices and foods, lemons, stuff like that can weaken that enamel, which can then, of course, cause tooth decay. So another reason for tooth decay could be dry mouth, xerostomia as we call it. Certain people who have diabetes, certain syndromes, taken several medications. What that does is it decreases the amount of saliva, and that saliva has enzymes and proteins in it that help stop growth of the plaque, and it helps also in stopping the plaque from adhering to those teeth. So saliva is really huge. It's a natural helper basically for fighting tooth decay. If you suspect you might have dry mouth, talk to your dentist. We have ways that we can definitely help with that. Lastly, tooth grinding. The more you grind on those teeth at night, most people don't even know they're doing it. You're wearing through that enamel, and the layer of tooth underneath the enamel is the dentin, and it is about 600 times softer than the enamel, and so basically that just makes it more susceptible to decay. So basically, let's brush, floss, rinse, and that can really help with a majority of these issues. If we did get some decay, we can usually take care of it with simple procedures like fillings. In some cases, you're going to need more protection, which we'll be looking at crowns, and if you ever have any pain or infection because of tooth decay, you'd be looking at root canals and possible extractions of teeth. But if you have any questions or concerns about anything that we've talked about today, or you think you might have some tooth decay, please feel free to call our office at 864-546-4242. It's Dr. Matthew Warner here at Willoughby Dental. We would love to meet you. We would love to do a consultation with you, clean your teeth, and we do offer a free whitening program, so something to consider. Thanks for speaking with me here, Greenville, and we look forward to next time. I hope that you have a fantastic day.